The chemistry behind being a pharmacist. What is a pharmacist? A pharmacist is a person who is professionally qualified to prepare and dispense medicinal drugs. Quotidian routine. The daily routine of a pharmacist includes filling prescriptions, such as filling an ADHD child's Adderall, a commonly known ADHD medication, or filling a woman's birth control, such as low estrogen, a popular birth control among young women. Contacting doctors and insurance companies, such as contacting a doctor inquiring about clarification on the directions for prescription, or contacting an insurance company regarding the coverage of certain medications for different patients. A daily routine of a pharmacist also includes consulting patients on questions regarding their medication, such as a concerned mother might ask a question about which and how much cough medicine to give their child who has a cold. Requirements. A pharmacist must have the medicines needed to fill prescriptions. One must also have reliable phone service to be able to discuss things with other individuals if necessary, such as contacting doctors. A pharmacist must also have very good people skills. This includes being able to discuss important topics with patients and being able to control a potentially hostile environment. Working conditions. A pharmacist is not limited to a specific attire, although most choose to wear a white overcoat often embroidered with their name and degree. The danger level is considered to be moderate because if given the proper training to become a pharmacist, the person is aware of the potential dangers. Stress levels can often get very high during a chaotic week where there are several hundred prescriptions to be filled. However, most, including one Ross Morrell, PharmD and owner of his own local pharmacy, NOLA Discount Pharmacy, describes it as well worth it for the satisfaction of his customers. Hazards. Certain medicines can be toxic unless the proper precautions are taken. For example, when putting boric acid into clear capsules for the use of the medicine, the pharmacist or pharmacy student must wear gloves in order to protect their skin from the potentially harmful side effects which include, but are not limited to, convulsions, nausea, diarrhea, and anuria, where the kidney fails to produce urine. Boric acid powder capsules are often used by women who insert the capsules vaginally in order to balance their alkaline levels. A pharmacist must also be able to identify potentially threatening situations and diffuse it successfully. He or she must be able to talk with patients in a professional and assertive manner in order to maintain in control of the situation and the outcome. For example, when a person comes into the pharmacy with a fake prescription, he or she must be able to come up with a viable excuse to not fill the prescription as to not upset and escalate the situation with the patient. Another example is when he or she must discuss with the patient the reason for certain delays in the filling of the prescription, whether it be due to insurance companies' obligations to abide by certain regulations or the doctors themselves being tardy in allowing refills for different medicines. One other hazard a pharmacist faces is the constant exposure to sick people. Due to the exposure to airborne particles brought in by patients with contagious diseases, a pharmacist must keep their work environment extremely clean to avoid catching illnesses. Places of employment. Although pharmacists typically work in a pharmacy, there are other types of pharmacists which explore a wider range of possibilities. For example, an industrial pharmacist can undertake research in the development, manufacturing, testing, analysis, and marketing of pharmaceutical and medical products. Also, consultant pharmacists, who are often employed by hospitals or pharmacies, provide medication reviews for residential care or ambulatory care patients and other medicine-related cognitive services. Personal characteristics. A pharmacist needs to have an extraordinary attention to detail in order to be able to count large number of pills without under or over prescribing medications. They must also have good math and science skills in order to count properly and to understand chemical compounds and reactions in the body. A pharmacist must also have the good communication skills in order to effectively assist in the instruction of taking medication. Education. In order to become a pharmacist, one must obtain a basic 4-year undergraduate degree and successfully complete pharmacy school, which is a graduate level program. Additionally, a PharmD student must complete a series of various clinical and pharmaceutical rotations, often anywhere from 7 to 10 rotations total. Thus, it usually takes 6 years to become a pharmacist. Job outlook and salary. There has been an increase in the demand for trained pharmacy professionals due to the rapid growth of healthcare and pharmaceutical industries. It is also predicted to have a shortage by as many as 157,000 pharmacists come the year 2020. Annual salary for a pharmacist can range anywhere from $116,000 a year to $140,000 a year. How is this field related to chemistry? Pharmacists have to take several chemistry classes in order to graduate. This comes in handy when a pharmacist has to create a compound for a prescription. For example, when a bipolar patient is prescribed lithium carbonate, the pharmacist must use their knowledge on the chemical composition of the compound in order to properly fill the prescription. It is also used when the pharmacist is asked questions regarding a product. He or she must know the effects of the specific ingredients or chemical compound in order to safely and accurately answer questions. Sources are accredited to NOLA Discount Pharmacy, Xavier College of Pharmacy, U.S. News and World Report, and the American Association of Colleges of Pharmacies.